Okay, first question. What is the difference between omega-3 oils and cod liver oil?
Fish oils and cod liver oils have a lot of aspects which are common. Both of them contain EPA and DHA. They're these two very important long-chain fatty acids, which are important to our health, and we'll go on to talk about them a little bit more later on. But EPA and DHA are important for our brain health, heart health, anti-inflammatory health, and as an antioxidant. In terms of their content within fish oil and cod liver oil, cod liver oils tend to have a lower content of EPA and DHA than most fish oils. So that's the first difference. The EPA and DHA content on cod liver oil tends to be lower than you would find in most fish oils. And that comes from the fact that obviously cod liver oil comes from the livers of cod, or livers of the codfish family. It's not necessarily just cod, but the cod family. So the oil of cod liver oil comes from the livers, whereas there's fish oil comes from the muscle of the fish. So if you think of an oily fish such as mackerel or herring, the flesh of that fish is actually oily, and that's where the fish oil comes from. In effect, the oily fish muscle is effectively squeezed, and that's where the oil comes from. The other major difference between cod liver oil and fish oil is that cod liver oil naturally contains vitamins A and D. And these are because these are the fat-soluble vitamins, so they're included in the oil because they dissolve in the oil, but they're concentrated within the liver, and hence cod liver oil has a high content naturally of vitamins A and D. What in fact happens typically with cod liver oils is that when the cod liver oils are processed, they lose a lot of their vitamin A and D, but then that is added back to the natural level. So a big difference between fish oils and cod liver oil is that cod liver oil contains vitamins A and D. The other thing that you tend to find is that fish oils, you see a lot of concentrated fish oils on the marketplace. So when you see oils that have a very high concentration of EPA, so maybe 30% EPA and 20% DHA, something like that. So 50% EPA and DHA collectively, then these will be a concentrated fish oil, and you don't really get concentrated cod liver oils. So it's really a matter of choice. If you want to, let's say, an unprocessed oil where you've got naturally occurring EPA and DHA, but it's at lower levels, but it also has naturally occurring vitamins A and D, then cod liver oil might be the oil of choice. If you're looking at delivering high levels of EPA and DHA, and a lot of people do want to do that, there's very good reasons for doing that, then fish oil tends to be the omega-3 oil of choice. So those are the main differences. In the end, if you were to say, well, okay, I suppose the summary statement is taking either cod liver oil or fish oil is better than taking none at all.
Okay. Do you think that it is better to take liquid or capsules of the omega-3 oils?
The issue in terms of whether omega-3, particularly fish oils, are taken as a capsule or as a liquid form, or as a teaspoon, for instance, that's all a matter of taste and palatability. In terms of getting high concentrations of EPA and DHA, then taking the liquid form, so a teaspoonful of fish oil, is a much easier and better way of taking high concentrations of EPA and DHA. So for instance, a teaspoonful of a reasonably concentrated fish oil, which is, let's say, 5 mils, will contain the same EPA and DHA as 4 large capsules. So if you're looking at using fish oil from almost a therapeutic point of view, in terms of as an anti-inflammatory, for instance, rheumatoid arthritis or some kind of inflammatory condition, then where you need high levels of EPA and DHA, then taking the liquid fish oil may be an easier choice, and obviously a cheaper choice as well. So that's basically that. The downside of that is obviously you're taking a liquid fish oil. Now, traditionally, that's always been very, very difficult because fish oil tastes of fish, and there's always been that association of fish oil being fishy. And in many cases, that is still true. However, there are fish oils now that have been refined in such a way that virtually all of the fishiness, in fact, all of it has been taken away. So there are fish oils on the marketplace which deliver high levels of EPA and DHA, which are virtually tasteless and odorless, and are very easy to take as a liquid supplement. Certainly easier than when I was a child, when you used to have in fact, a dessert spoonful of cod liver oil every day, and the cod liver oil was horrible. So we've moved on an awful long way from that point. So yes, it's a very viable way now. Now, just in terms of coming back from that, capsules are still, I suppose, the most popular choice, and it is because, having said what I've said about fish oil, you are still taking an oil. It still has an oily mouth feel, even though it doesn't have a fishy taste. It still has an oily mouth feel to it, and some people just don't like to have that type of mouth feel in their mouth. And so for those people, then capsules are still the option. Similarly, it's often held that capsules, that you don't get those sort of fishy burps quite as much if you're using capsules as opposed to the oil. That depends more upon the oil rather than whether it's in a liquid form or whether it's in a capsule form. So if you're taking if you like, an odorless fish oil, then you don't get those fishy burps anyway. But for a lot of people, they just prefer to take capsules, and that's perfectly fine. The only downside to that is that you have to take lots of them if you want to deliver high levels of EPA and DHA, and they're more expensive. So,
when would you say is the best time to take either capsules or liquid omega-3s, whichever you decide?
It doesn't really matter. I think the most important thing is that fish oil is taken with food, particularly liquid fish oils. The reason being is that we normally take oil as part of a mixed diet, and if you take a liquid oil just on its own on an empty stomach, it can, what you can get is a feeling of slight nausea, and that's because you've got oil just sitting on the stomach lining, and it doesn't sit well, and so it gives a slight feeling of nausea for some people. So the easiest thing is to take fish oils either with food or just after a meal. It doesn't matter which meal.
Okay. And how many or how much of the liquid or how many capsules would you recommend a day?
It really depends on what you want. Up until a couple of years ago, it was generally considered by most authorities, World Health Organization, for instance, or the Scientific Advisory Council in the UK, somewhere around 500 milligrams of EPA and DHA collectively was about the minimum amount that you would need on a daily basis of EPA and DHA. And I would still say that's about right. EFSA have just brought in a lower recommended level of 250 milligrams EPA and DHA collectively. But I think that's actually a little low. So 500 milligrams, I would say, is, from my point of view, minimum. And then it depends then what you want to achieve. If you're looking at anti-inflammatory effects, then you need to go higher. So, and I would say that all of the evidence out there, all of the scientific evidence, if you're looking at rheumatoid arthritis, for instance, then the evidence suggests somewhere between 4 and 6 grams of EPA and DHA a day. And if you're looking at ulcerative colitis, again, similarly, between 4 and 6 grams of EPA and DHA a day. If you're looking at, let's say, lower level inflammatory conditions, such as people who have been doing sports, where there's a, if you like, there's a minor inflammatory effect, but because these athletic people are training intensively, but they're training frequently, what they have is, in effect, very small but frequent events of a mild inflammatory process. But if you take that over a long period of time, what you effectively generate is a process that's very, very similar to a chronic inflammatory condition, although it is a low-level chronic inflammatory condition. So there, I'd be saying something around about 1.5 to 2 grams of EPA and DHA a day. And that just so happens to be, I mean, there are oils out there, for instance, like the Aliment oil, where that 1.5 to 2 grams comes from a single teaspoonful a day. So that's just an example of, if you're wanting that higher level of EPA and DHA, a very easy way of actually achieving